I work on behalf of Aparito Digital Health in partnership with Actelion Pharmaceuticals and NPUK to look at the value of wearable technology and mHealth in monitoring patients remotely. So we know that it's incredibly difficult to get a true understanding of the impact of the disease on the patients and their lives. And we also know that hospital-based tests are very sterile and only give a snapshot insight into disease severity and what life is like for a patient on a day-to-day basis. So the idea is that we change the way that we monitor patients and offer wearable technology as a way to monitor patients continuously and passively in their own home. So far, we've been up and running 18 months and we've got 4 patients using the devices, and we're getting really good data that shows how patients' day-to-day patterns correlate with patient-reported outcomes and events that they're reporting. And the hope is to extend this to more patients and to learn more about symptoms like ataxia, falls and seizures as we do this. We know currently that clinical trials are extremely hard to do, and we know that 42% of pediatric clinical trials are inconclusive. So that's not saying that the drug didn't work, but the data collected was not able to demonstrate that conclusive. We also know that in orphan drugs particularly, the bar is much higher, and 37% of orphan drugs are currently not being reimbursed by health technology assessments. And healthcare as a whole is completely changing, and I truly believe that technology is going to be one of the biggest factors that changes the way that we currently care for patients with long-term illnesses. I feel very strongly that we should be moving as much patient monitoring away from the hospital clinic and into the home. And I also think that we should be relying more on getting real-time data that tells us exactly what's happening so that we can identify patterns and changes in disease severity much quicker than we do by relying on hospital tests between clinic visits.